Good afternoon, sir. So, how to differentiate between migraine headaches and all other types of headaches?
Yeah, okay. First of all, we know that that you might know that there are different kind of headache. So when we are talking about migraine, so it is very necessary we have to differentiate it clinically, how it is different from other types of headache, like stress headache, tension headache, headache due to sinusitis, headache due to spondylitis. So many types of headaches are there. So when we talk about migraine, so migraine is a one kind of episodic headache. And while we explaining the definition, they say it is a idiopathic headache which have more than 5 attacks per year. And while going for the symptoms, so during the headache, there should be a phonophobia or photophobia. So you know about phonophobia or photophobia? Yeah, so irritation from light or irritation from sound. And next thing is, it can be unilateral or bilateral. It is nothing like it should be one side or half side. It can be a whole head or one side or both sides or around the socket of these eye sockets. So it can be unilateral, bilateral, and there should be nausea or vomiting. And there should not be a close relation to of any other disease, like sometime due to, if there is an error in your eyesight, then also the headache will come. So we should rule out, is it directly related to that thing? In close relation means somebody have diagnosed with headache and simultaneously also diagnosed with problem in the vision. So then we can correlate it, or it may be due to vision. But if your headache is happening since very long and this vision problem is now, so we can rule out no, headache is not related to this. So these are the symptoms. And another symptom is, it will increase with the sustained exertion. So suppose if you are having headache, and if I will tell you to do the work, that will keep on increasing with that work. And patient feels like pulsating. They can explain you that something is going inside the head, like pulsation, like of feeling. How can you ask? You can ask like putting your hand on the pulse. So he will explain that it is same kind of feeling. So pulsating kind of headache it is. So what we can say, any episode which are having more than 5 attacks in a year, unilateral or bilateral, and when very peculiar symptom is, it remains from 4 hours to 72 hours. Whatever you do, it will not go automatically without 4 hours. And usually it goes after 72 hours, with or without treatment. Sometime when it comes to chronic headache or drug dependent headache, then people comes with headache. They complains that I am having headache every day. So that this is the just general differentiation as per the International Headache Society. So one is 4 to 72 hours duration, unilateral, bilateral, phonophobia, photophobia, nausea or vomiting, and it should not be related to any other disease in near future or past. So that is the main differentiation of this.
Okay. How it is impacting the population?
Yeah. So this migraine is one of the most prevalent diseases in the world. Almost 1 billion cases in a year throughout the world, and it is creating more socio-economical burden on the society, because this disease is creating debility, and it reduces the productivity at the work. If somebody is having work, somebody is having pain, definitely either he will skip the work, or the productivity of work will be less, or the quality of work will be very less. So this disease creates the disability in the patient, and it disturbs the quality of life also. So it is very much necessary that if we have to improve improve all these things, like in the society, socio-economical, in the society, in the personal life, then we have to take care of this disease. And it is related to many other things. It produces stress, it creates sleep disturbance, and I have seen that many cases are becoming like they have feeling like a suicidal tendency when they are having recurrent attacks again and again.
So how to analyze migraine in Ayurveda aspect?
Yeah, okay. So till now we have talked about the general aspect of the migraine, is for the modern terminology and all. And the modern science considers this disease under neurological disorder, but it is very funny thing. They have said, tell in the definition only that it is an idiopathic headache. Means they don't know the reason behind it. So on the same time they are dealing it under the neurological disorder because of the reason. It is coming to head. So they consider reason. But till date, there is no findings found that which can diagnose as a migraine. But I think lately, even yesterday, somewhere I read that they found some radiological changes in the CT scan of head in the patient of migraine. There's some changes anatomical changes in brain. I know that is very latest advancement. But while we're talking about Ayurveda, so if we go through the symptoms, then we can find out what it is exactly. So we are saying nausea and vomiting is there. So what is Hirlasa, Utklesh, and this Chhardi. So these all three symptoms related to gastrointestinal. Okay, and one another symptom is like phonophobia, sound irritation. So sound irritation, where it comes? Rasakshaya. Rasarokshan, Shram, Shosha, Glani, Shabda. So then that is also another clear-cut indication that Rasakshaya is there, disturbance in the gastrointestinal only. And then sound irritation also, and phonophobia, light, any kind of light. Especially patient will complain then while going into the sun, they feel they will start having headache. So what does it indicate? Atharva. Atharva sevana is pitta vriddhi. So then we are coming very near to the diagnosis.